Powered by youth, driven by purpose. Welcome to the Brain Camaraderies podcast, where we spark conversations, spread neuro-awareness, and stand for change.
Hello, everyone, and welcome back to the Brain Camaraderie podcast. I'm Yathika Sivani Muthukrishnan, the founder and CEO of the Brain Camaraderie, a youth-led nonprofit dedicated to supporting patients impacted by rare, misdiagnosed, or undiagnosed neurological diseases. Today, I'm bringing you a special episode. We recently had the immense privilege of interviewing Dr. Nusrat Habib Rana, who is a truly inspirational figure in global mental health. Unfortunately, due to some technical difficulties and internet errors, we weren't able to publish the original recording as intended. To ensure her invaluable insights still reach you, I'll be walking you through the highlights of our conversation, share what we discussed, and what Dr. Nusrat had to say, all from my perspective. Let me begin by telling you a little bit more about Dr. Nusrat Habib. She is a psychiatrist with nearly 5 decades of experience, and she practiced in Lahore, Pakistan. Her qualifications are truly remarkable. She holds a PhD from Spain, an MD from China, an MCPS from Pakistan, an MSc in Affective Neuroscience from Italy, an MS from Maastricht and Florence European Union's program, an MPA from Punjab University, and a CBT certification from Oxford. Dr. Rana is widely recognized for her unwavering commitment on writing about healthcare to raise awareness and advising patients on healthy living. She is known for actively working to break down the cultural and systemic barriers that often limit mental health conversations in South Asia. Her work specifically confronts misdiagnosis, generational trauma, and even the genetic links of cousin marriages in women and young girls. Through her compassion, advocacy, and education, she has truly reshaped what mental health care looks like in her region. In our discussion with Dr. Nusrat, we looked into how women, especially young girls in regions like Punjab, Pakistan, suffer due to cultural stigma, misdiagnosis, the impact of generational trauma, and a significant lack of access to neuropsychiatric care. To begin our conversation, I asked Dr. Nusrat to share a little bit about herself and her journey into psychiatry. I specifically wanted to know what really led her to focus on mental health challenges faced by women. Dr. Nusrat shared that her journey into this field was a very painful and powerful journey. She recounted the harrowing experience from 1974 when she was in China for her MD, where she often had to stop over in Karachi. During one such delay, she visited the Hyderabad Mental Hospital and described it like a zoo. She vividly recalled seeing lots of patients, like 4,000 patients, all blocked or locked up in cells, and there was not much medicine to give to them. This is the early exposure that clearly shaped her dedication to mental health. She also highlighted how in many parts of Pakistan, mental health is not properly acknowledged or even understood as a legitimate condition requiring care and treatment. She passionately expressed her hope in the younger generation, like us, to help address this deeply stigmatized mental health issue and bring it out into the open. Next, my co-host Christine built upon this to go deeper into the nature of misdiagnosis in women. She asked Dr. Nusrat about what misdiagnosis looked like in her experience and why it happened so often. Dr. Nusrat explained that mental health is always stigmatized regardless of the patient's gender. She noted that in Pakistan, as well as other places in South Asia, mental health is often associated with shrines and supernatural explanations like evil spirits or supernatural things, rather than being understood as a biopsychosocial phenomenon of the brain. Conditions like bipolar disorder, schizophrenia, and PTSD are often missed, particularly in girls. She further elaborated on the language and cultural barriers that contribute to misdiagnosis, and noted that psychiatrists often trained in Western countries like the UK or USA. Because of this, they may not speak local languages like Punjabi, which creates a communication gap. Patients might also find the decorum of psychiatric hospitals or clinical alienating. To address this, Dr. Nusrat and her team adopted a community psychiatry approach, going to patients' villages, engaging in storytelling, and using theater to help individuals express their stresses and issues in a relatable way. Next, we talked about the array of barriers women face in accessing mental health support. My co-host, Christine, asked Dr. Nusrat a very pertinent question. Rural women often face significant obstacles such as limited access to professionals, overwhelming financial struggles, and the pervasive issue of having their entire lives dictated by family decisions. We asked her how education, economic empowerment, and even social media could change this reality for them. Dr. Nusrat emphatically stated that economic independence is the only solution for women. She explained that when women are economically independent, they gain the autonomy to say no to decisions taken in their lives for them and can make their own active decisions. This empowerment, which fosters education and economic independence, plays a very important role in their ability to make independent choices in their life. She even suggested that community healthcare workers who already visit villages for vaccination programs could be trained to address psychiatric issues. This draws a parallel to historical Trinjan gatherings where women could collectively engage in activities like knitting, creating safe spaces for interactions and discussions. This could also empower them to, again, make independent decisions in their lives. Christine then highlighted that mental health stigma and generational trauma are global issues, but seem particularly intense in Pakistan, especially with the language barriers. She asked Dr. Nusrat to explain how the stigma and generational trauma affect women specifically, beyond just the spiritual aspect, and how joint family systems might impact mental health or challenges. Dr. Nusrat confirmed that joint family systems in the villages is very oppressive. In such environments, girls may struggle to express themselves, and this may potentially lead to suppressed emotions and difficulty in recognizing the trauma. Following this, Christine also brought up the sensitive topic of cousin marriages and their link to higher risk of disorders like bipolar and schizophrenia. Dr. Nusrat's work explicitly addresses these genetic risks linked to cousin marriages, especially in women and younger girls, which are known to increase the prevalence and severity of conditions like bipolar disorder. Something I found beautiful is that Dr. Nusrat also uses a unique style of Sufi poetry in her care approach. Dr. Nusrat elaborated on how spiritual and cultural practices help women heal, especially when westernized methods may not be as relatable. She explained that by using local poetry like Kheer, Marisha, Bulesha, and even Nanat Gurbani, she creates a connection, helping patients, particularly illiterate women, express their emotions and understand their stresses. She cites the poet Bule Shah, who famously asked, Ki jana mein Khan, to illustrate how such culturally resonant expressions can provide a language for these inner struggles. She contrasted this with Western-style therapies like CBT, where an illiterate patient might not grasp terms like negative thinking, but would understand a Punjabi term for doubts. She also noted that faith healers are often the first point of contact for mental health patients in Pakistan. These patients often visit them before the medical professionals and sometimes attribute mental illness to supernatural causes. While studies are silent about the outcomes through these healers, they can be effective in identifying mental health causes and could be integrated with medical practitioners for early reference and appropriate treatment throughout the social dialogue. Next, we discuss the array of barriers that these women face in accessing mental health support. My co-host, Christine, asked Dr. Nusrat a very pertinent question. Rural women often face significant obstacles such as limited access to professionals, overwhelming financial struggles, and the pervasive issue of having their entire lives dictated by family decisions. We asked how education, economic empowerment, and even social media could change this reality for them. Dr. Nusrat acknowledged that this is indeed a significant problem. She explained that a major challenge is that current medical books and educational material are predominantly sourced from westernized cultures, such as the UK and USA. She stressed that there is a profound need for materials that are not just translated, but genuinely written in local languages, which reflected the local culture and utilized the appropriate styles of expression. This means that simply translating existing westernized sources isn't sufficient enough. The content itself needs to be culturally appropriate and relatable to be truly effective in communities like Punjab. My co-host then raised a very sensitive and important question. Does childhood trauma in these girls receive the attention it deserves in mental health policy and practice? Dr. Nusrat described this as a very difficult and very important question. She elaborated on the complexity of identifying such trauma, stating that it's often difficult for healthcare workers themselves to even fully understand it. She explained that when a child is experiencing trauma, they seem very high or disconnected. Often, their symptoms are diffuse and cannot be neatly categorized into a single diagnosis. Instead, they present with multiple problems. Dr. Nusrat shared an example to illustrate this challenge, as well as her approach to this challenge. She emphasized that if you try to force a child to reply and tell us what is happening, they will never come up with anything. Instead, she recounted how she and her team used a different approach. Recounting from one of her anecdotes, she stated, "We just narrated small stories, parrot stories, cow stories, and these types of things. Although this was a gentle and indirect message, the children were able to come up and complain. The complaint revealed many things. For example, a child was harassed by her uncle in the house, and she was so scared of going to the house and staying there where it should have been a place where one should feel safe and secure." Following this impactful example, I then asked Dr. Nusrat a direct question about how youth-led groups like the Brain Camaraderie can support mental health in Pakistan and other hard-to-reach areas, especially considering the language barriers, government policies, and cultural norms. Dr. Nusrat's guidance was very clear and empowering. She stated that the best is to talk about the issue and make it an issue on social media and start the way that we are doing. She emphasized the importance of giving it a language, giving it thought, and giving the patient a chance to express themselves. Dr. Nusrat firmly believed that when you start this conversation, when things are coming on this table, people can actually talk about it. Her advocacy for addressing these taboo issues, even if they're culturally sensitive, as well as the grave human rights violations such as honor killings, directly inspires her approach. She believes it is crucial to raise awareness about personal stories and testimonies from individuals who have overcome addiction or trauma, and stressed the necessity of collaborating with healthcare professionals and lawyers to address these sensitive issues effectively. Finally, to wrap up our incredible conversation, my co-host asked Dr. Nusrat what gives her hope for the future of women's mental health in Pakistan and what positive changes she is currently observing. To this, Dr. Nusrat expressed a profound sense of optimism for the future. She shared that she feels optimistic because she is seeing more individuals who are able to really connect with different forums or organizations who can relate with them and who can really talk to them. This observation signifies a crucial shift towards creating more compassionate spaces and fostering a more global network. Her dedication to promoting education and connecting patients and researchers, as shown by her tireless work, is invaluable to our audience. Her insights not only further our understanding of mental health, but also inspire actionable ways young people can contribute. In the meeting, she discussed that youth can participate in awareness campaigns, initiatives, and volunteer-based mental health outreach. The Brain Camaraderie is deeply committed to continue to share these really important conversations. Our overreaching goal is to empower individuals and promote ethical and sustainable healthcare solutions for complicated neurological conditions. Now, if you're listening and feel impacted by this conversation with Dr. Nusrat Habib Rana, please consider sharing this episode with a friend or on social media. Your support really amplifies these crucial voices and spread awareness about neurological health. You can find more information about our mission, resources, and how to get involved throughout our media. Be sure to follow us on Instagram, LinkedIn, Facebook, and all the other platforms out there to stay updated with the Brain Camaraderie and our work. Thank you for tuning in. We really hope this deep conversation with Dr. Nusrat has been insightful and inspiring for you as it was for me.